good evening, good afternoon, depending upon where you are in the country. And welcome to Back to the Future, this evening's webinar on getting our choruses back to something resembling whatever normal is going to look like as we go forward. My name is Robin Godfrey. I am the Executive Director of Gala Choruses, and Jane Ramsire Miller here as well, the Artistic Director for Gala Choruses, and a distinguished panel of lots of folks from across our member choruses and the Gala board, who we will introduce as we get to the sections that they're participating in. Just a couple of administrative things here. We have 180 people registered this evening, so we are going to leave you on mute. Please put your type your questions into the Q&A box. We will get to as many of them as we can. What we aren't able to get to, we will take down and get answers to you in the next few days. We are recording the session. And we will put the recording up on the website. You will automatically get an email with a link to where the recording can be found. All right, with that, I think we're ready to go with the first section this evening. Our presenters for that are Kathleen Hansen, Artistic Director of the San Diego Women's Chorus, Karen Lane, Executive Director of the Seattle Men's and Women's Choruses, John Quillen, Managing Director of Gay Men's Chorus of Charlotte, Linda Morrow from the San Diego Women's Chorus, and Robert Gore, Artistic Director of Our Song from Atlanta. So with that, let me pass it to Kathleen, and off you go.
Hello, thank you for that. So we have this organized kind of into questions that we need to answer, because none of us are really here to give you all the answers. It would be so easy if we just had to hear 10 things that everybody should do and we could do it, because we know that how different each of our local situations are and our local groups. So we've kind of put together some questions as a starting point for conversation. Like, these are questions that we need to answer in order to move forward. We have a pretty diverse team assembled here. So this first section is called Preparing for a Live Season and In-Person Rehearsals. We anticipate that this will probably take a good 40 minutes or so to get through this. We would love to see your questions in the chat. We may or may not get to them immediately. We may save some of them for a little bit later. So we're going to go around with our group and just chime in on some things we've been researching and thinking about and doing with our groups. And the first question for us is, what performance hall / church contract clauses regarding COVID should we anticipate, and how should choruses respond to those? And Robert's going to kick us off with this one. That is after Robert unmutes, then he will kick us off with this one.
Sorry, I thought someone else was controlling that. That's what I was hoping for. Hi, everybody. Thank you, Kathleen. So my experience has been with doing recording sessions. We aren't in full rehearsal mode yet, but there are some things within that I can share. And then I think for discussion, we can go on forward with that. And that is that they will be asked for policies and procedures of your organization and how you plan to go forward and keep things separated and like that. So expect that. Also, what their policies and procedures are as far as space and normal things. I think we'll talk about later about spacing and entering and exit and all that. Somebody else will deal with that. But some things you do need to have are proof of liability insurance. So plan on that. Also, I think timing is really important. Of what I have found out is a lot of this has to go through committees. We all know how long committees take to do things. So if you're going through a church and you have to apply, usually those committees only meet once a month. So they want you to do it a month in advance. So kind of think of timing as you're going through it. Some things that clauses we asked for we asked for the space not to have been used for 48 hours before we came in. And so you might want to think about things like that. Probably would feel slightly different about that now, but that was in December. I'm negotiating now for late May. So those are the things that kind of to start looking at. And then I'll move on.
Great. And I'm wondering if there are kind of on the other side of that, things that we would want on our side of the contract, kind of like you said, a space that hadn't been used for 48 hours. But I'm thinking about things like how do we deal with restrooms and making sure that the site is ready for us and things are set up. Who's going to set up the chairs and when? Does anyone from my committee have any experience with that, or do you have any more thoughts on that, Robert, from your experience?
I will say yes, I do. We did things like warming. We agreed ahead of time to warm up outside, so we did not come until the end. We came in by sections in small groups. So we had told them we were going to do that, and then we exited a different way, and we asked everyone to leave as quickly. And we agreed not to use the restrooms, but ours was like an hour long. That was just to keep it much easier on our end. I would suggest that if you do, that is one designated restroom, and then you would also take care of making sure that it was prepared. That's what I'd suggest.
Did anything in your contracts with this location surprise you, or was it pretty much what you thought it would be? So there's an insurance requirement. They wanted to know what your plan was. Anything else?
I didn't find anything surprising or out of what I would have wanted for wherever I was.
Okay, great. Anything else on this topic? Looking in the chat, and is widely available vaccination now changing your plans for the fall? We're definitely going to get into that a little bit as we go. But I'm assuming, Robert, that when this happened, none of your folks, this was pre-vaccine rollout, right?
That's correct. And I'm hoping everyone's vaccinated the next time we do it in late May, but I'm still working on that. But being vaccinated would be great. And most people, we'll talk about that later.
Okay, yeah, we've got some of this stuff coming up. And if I see questions pop in the chat box that I know we're going to get to, I'm probably just going to let those sit until we get to them. Quiz's question number 2. What is best practice regarding the elements of a plan for returning to live activities? And I think this is the place where we really need to do our homework to make sure that we have checklists. So I'm going to ask Linda to share a document. This will go up on the website as soon as we have an opportunity to do that. And it's kind of, you're seeing more and more of these things come out literally just this week. So I don't want to read all of this to you, and I know that not all of you can see it, but just to let you know, there's a link to this now in the chat box. So we have health and safety concerns, things that we need to answer, financial considerations, logistics considerations, sponsorship considerations, programming and production considerations, community relations, final comfort level. And I'm going to put another link in the chat to an article called Coronavirus FAQ. Is choir practice okay now? And that is kind of going through some of the same things that we're talking about wearing masks. How long should we wear them? What happens how do we alter them for better singing? We'll talk a little bit more about air filtration as well, and distance and medical risks and things like that. But I think what we're starting to see now, which we all, sorry, my window went away, which we all want to be paying close attention to, is as these lists come out, figuring out which things are most applicable to us. We care about our culture, we care about our health and safety. And I want to ask from my team if there are any other things you have to add to this regarding the elements of a plan for returning to live activities. What has worked for you already? which things are on your radar that we want to make sure we're talking about. Linda, do you want to talk here? And I know that we're going to talk about it later, but I just want to introduce the idea of talking widely to singers about their comfort level.
Sure. So I think as we started to think about getting ready to going back to performing, rehearsing and performing together, the biggest outstanding question in my mind is what does the chorus want? What is the chorus comfortable with? What are they hoping to do? What are their comfort levels? And so what we did as an organization is that we actually sent out a very brief survey where we actually surveyed the chorus members around their ideas around vaccination and their comfort levels with coming back without a vaccination requirement in place. And we do have that, Kathleen, as a separate question. I don't know if you want to wait to.
No, I just wanted to introduce that topic. I think we can get a little deeper into it in a little while. But as I'm thinking of high level, broad umbrella considerations, we have the health of the organization to take into account. We have the health of individuals to take into account, in addition to all of the logistics that are going to be on our checklist. So I just want to make sure that kind of person to person considerations are being handled as well, especially with these highly charged conversations. Let's move on to question number 3, which is, how can you find out about the ventilation in rehearsal and performance spaces? And John's going to kick this one off.
This is really going to be hard for a lot of people because, if you rehearse in a church like we do, the ventilation system predates Jesus, and it certainly predates the people that are there on staff now. And so they generally don't have any idea about the capabilities of the system. They know whether it's pumping out warm air or cold air, and that's pretty much the extent of what they know.
Or if it's not pumping out any
right,
air,
which is mostly
we've all experienced most likely.
So if you there are several studies that have come out. One from the University of Northern Colorado. There's one from NFHS. They talk about trying to get something that allows the air to turn over at least 6 times an hour. That's going to be really a tough mountain to climb for most HVAC systems that weren't installed in the last 5 or 6 years. And if you're most of us, these systems were installed in the 50s. So, you're going to have to sort of take all of that into account. There are ways that you can help clear the air by purchasing small units that allow you to, when you vacate the space or vacate it temporarily, it's not, they call them air purifiers, but they're not purifiers. They just help scrub the air a bit, but they can help. So those are the things that I know that you're going to want to look out for, but getting clear answers is going to be hard.
Right. I think a lot of us just can't count on that. I do know a lot of my colleagues in educational spaces, a lot of the schools invested in freestanding air filtration systems. And I would imagine that that's something that some of us might want to think about if the spaces that we're going into, often they don't have money to install multi-tens of thousands of dollars new HVAC system. So how much can we do on our own? The question is, a space with windows that open better. So in the studies from the University of Colorado, it feels like a million years ago now, they actually had some airflow animations, and they showed different rooms that were just like completely enclosed versus one that had better airflow, like a window on one side and a window on the other side versus just a window at the top. And I think it's pretty clear, and it's probably just something that makes sense to a lot of us, is the more airflow we have, the better. It's like they're saying, if you're outside in a tent with completely open sides, that's great. If you're outside in a tent and all of the walls or fabric walls are closed, that's just like being inside with no airflow. So I think airflow is our friend. I think the other question that people are going to have is, how much do we care? Once we have a room full of people who are vaccinated, how much do we care about airflow? It makes me feel like all of those times during chorus rehearsal where somebody shows up with a cold and it wipes out, half of a section. Maybe this is something that we'll all just get a little bit better at being careful with our contagion. Linda, do you have any thoughts about that aspect of it? And maybe this is a good time for you to just mention your credentials in this regard.
While I'm president of the board for the San Diego Women's Chorus, I'm also a physician by background and training. Spent a couple decades practicing internal medicine and geriatrics before transitioning over to drug development. And I spent the last decade in drug development, but also and now working as a consultant, and just happened to write a white paper for an investment firm on vaccine technology. So we'll get to that shortly here as well. So, but thank you. Kathleen, the other thing I wanted to mention with regard to the space with windows, it's just as you said, I saw another study where they actually looked at a school where they compared having the windows open in a classroom and looked at the airflow and how much improved it was by having the windows and the door open to the classroom versus having both of those closed. And so it looks much safer to open all the doors and windows that you can. Of course, when it gets to be 90 degrees in the summertime, nobody's going to want that.
Right.
So
that's great. Airflow is your friend. Air filtration is your friend. I heard it. Was that you, John?
It is. The one thing that I would say is that the University of Colorado put together a risk assessment tool that you can use that's helpful in this particular, and I've just put that in the comments.
That's great. Thank you so much. Let's move on to number 4, which I'm also going to throw back to Linda. And the question is, how much do you need to sanitize, and how best should you sanitize?
So for me, the simplest thing to do was just to go to what the current recommendations are from the CDC. And so I'm just going to share what are the latest recommendations around this. And I think we'll all be happy to see that the recommendations around how we sanitize have gotten much reduced, as it's become really apparent that this is largely an aerosol transmitted disease and not a fomite or a touching surface related disease. So these were just updated from the CDC on April 5th. And what they tell us is that the risk of infection from touching a surface appears to be quite low. And really the most reliable way to prevent infection from surfaces is to regularly wash your hands or use hand sanitizers. They also said that if you don't have people with confirmed or suspected COVID in the environment, just cleaning once a day is enough to remove any viruses that are on the surfaces. And they also said that you don't have to do anything more elaborate than just use household cleaners that have soap or detergent. So we don't really need to sterilize things or use harsh anti-infectives in usual environments. And as we're thinking about returning to singing together, hopefully most people will be vaccinated. It makes it less likely that there's going to be active, either confirmed or suspected COVID among your singers, so that the requirements, I think, are much less than we might have anticipated several months ago.
That's great.
I'm going to stop sharing.
And we'll come back to that.
And we'll get to that.
I'm going to move on to our next question, which is, how should choruses handle the differences among singers regarding when they're ready to come back to live rehearsals? Some ready once they're vaccinated, some will feel ready when herd immunity is achieved. Some already feel ready, some may not. And this seems to be a huge conversation, right? This is one of those pivotal, how do we determine when, how do we determine where, how do we determine who to invite? Are we ready for the whole group? So yeah, I mean, I guess we get 3 in a row for you, Linda. Let's let you lead off with this one. So
here we go. You already had a preview. And as I was saying, we really thought that it was very important to query our membership around what they were thinking with regard to vaccination. And so we sent out a really simple survey. Are you planning on getting vaccinated? Would you come back if we don't have a vaccination requirement? Would you come back if we do have a vaccination requirement? And I was thrilled to see that out of the 116 responses that we got back from our chorus, that 96.6% of them said yes, they were planning on getting vaccinated or actually had already been vaccinated. We did the survey about a month ago. And those two little, the red and the orange are a total of 4 people, two in each block. We completely anonymized this survey. I thought that that was really important to do that so that people could feel comfortable giving us hopefully true information without feeling that they would be stigmatized if they said no, they weren't going to or wanted to give some reason for that. So that's what we found out. When we asked the question, will you return to chorus if we don't require vaccinations? I was a little surprised to see this, maybe, in that only 35% said absolutely yes, they would come back. 44% said maybe, and a full 20, almost 21% said that no, they would not return if we didn't require vaccinations. And then when we flipped the question around and said, will you come back if we do require vaccinations? We had 89% of them saying yes, they would, with another 8% saying maybe. So again, almost 97% of the chorus saying if we require vaccination, they'll come back. And then we just had a couple people who said no, they wouldn't come back if we did require vaccination. I think we saw this really as a strong mandate from our chorus membership to require vaccination to return to singing. So I know it's been really controversial, and I think we're getting to legal questions in the next section. But our transition team is taking this quite seriously and are seriously considering requiring vaccination to return in order to return to singing. I think there are 2 factors here. One, of course, is protecting the safety of our chorus membership and our chorus staff. And then the other thing, it relates to liability. And so providing a safe environment for everyone. The hard question really becomes, well, what if you have people who aren't able to get vaccinated for medical reasons? Should we allow them? And that is a question that our transition team is still sort of grappling with. So no answers there yet, or we haven't made a decision around that, although we're leaning toward requiring vaccine for everyone.
And I think that survey was literally just a Google form, and it was those 3 questions. It was, are you planning to get vaccinated? Would you come back if we didn't require vaccines? And would you come back if we do? So obviously, yes, we are talking about personal medical information, and people volunteered the answers to it. We did not force anyone to give those answers, and we protected their anonymity. I'm going to open this up because I think John has a few extra things to say on this.
I think it's important to note that answers vary by state. Here in North Carolina, we can do pretty much anything we want to do. That may not be the case in Missouri or Oregon. So make sure that rather than relying on just news sources, if you've got any questions, get a lawyer and HR expert that can tell you the answer and that can differentiate between volunteers, which are your singers, and the staff, and then contractors that you use, because the answers may be different for all 3 of those groups. And you don't want to run off sort of half-cocked.
For sure. And I wrote a note on my piece of paper here on my notes with a big asterisk that says verify your sources, because something that I heard from Ferris's best friend's cousin's brother in 31 Flavors might not be a good enough answer for that.
Kathleen,
yeah, go ahead.
May I add something really quickly?
Please.
And that is that this is obvious to me, but just to point out that the San Diego Women's Course did the right thing. They went to their people, they surveyed them, and talking to I think every course is going to have a different vibe on that. So listening to them is really important as part of the process.
I wanted to just take a couple minutes. This is the question we'll spend the longest on. I have permission to share from Sean Bao. How do you say his last name? Is that correct? From Turtle Creek.
Fall.
They had an in-person rehearsal this week. And everybody had questions like, how did you do it? How did you do it? So they're out in Dallas. They met in a huge church. They had 160 people. Everybody was masked. Everybody sat 6 feet apart. Some questions came through, and I'm just going to share with you what they did. So they rehearsed in this giant space. They also live streamed that for anybody who couldn't go. They maintained 6 feet while singing, as well as during their stretch break. It was a 2-hour rehearsal. They did not clear out in the middle. I know that a lot of recommendations say stay there for 30 minutes, clear out, come back. It's probably hard with that many people. Kristen, you can go ahead and drop that picture, and I think it's pretty good picture. They didn't worry about the airflow. It's a very, very tall room, and they required vaccinations. They required proof of vaccinations. They had everyone turn that proof in. Only one person in the entire organization was privy to that information to keep confidence. But they said, hey, if you're going to come to this, we're going to require proof of vaccination, fully vaccinated, not half vaccinated. They provided their card via online sign up. No one was allowed in the room who did not do the online sign up. And the question comes up, how did the group feel about anybody who was excluded from this, which we know is sensitive. But for the health of the organization, they decided that it was time to go ahead and keep this rolling and keep doing this. So my screen has frozen, so maybe somebody can type in if I'm still being heard right now. There we go. So here's a picture from their rehearsal of the setup. Note in the chat that Sue offers that 10 feet is recommended for singers and orators. Again, so much of this information is in flux and preliminary, and we just haven't had vaccines long enough to have hard data about it. Trying to think if there's anything else I wanted to share from that. Oh, the extension of that is as state and local regulations will continue to change. I know right now in our county, what they're working on is saying, for example, that they're going to allow a certain number of people in a certain size space, up to 150 people, if everyone shows proof of vaccination. So they're working on actually legislating that locally. If that's the case, if you're kind of lucky enough to be in that situation, then you can just piggyback on that and obviously consult your attorneys. Does anyone else want to comment on that before we go on, John?
I just had one last thing, and that is that there's a lot of discussion about why people do or don't, or able to get vaccinated or not able to get vaccinated. And in the end, a person who chooses not to be vaccinated and a person who for some medical reason can't get vaccinated poses the same risk or is at the same risk. And so, the discussion, I think most of the discussion is, can we allow vaccinations or require vaccinations for some period of time? Not forever, but maybe, every 3 months we're going to look at this and decide again, is this still a good idea? Is it still necessary?
Great. And they'll cover that more in the legal section. So moving on, should health status questionnaires be used before rehearsals? And if so, what questions should we include? And I'm going to let Karen lead this one off.
It's my turn and time for a little bit of levity. Okay. I got this one really because I opened my big mouth and talked about the fact that Kathleen is nodding in agreement. Thanks a lot. Okay. That I've been filling out a daily survey for my child to go to school every morning since fall when she went back. And at first it was like, ugh, this is a nightmare, but it's really just a Google Doc. It's simple. It hasn't changed a ton since we began, but it has adjusted some as we've gone along. And so the answer to the question germane to here is that, yeah, I think we will have a pre-rehearsal survey. Exactly what will be in it, I don't know, because, you know, these things do change from week to week and day to day. But I think it's probably not changing as fast as we really would all like to think that it's going to change. Many behaviors that we need to protect ourselves are going to be in place long after full vaccination, in my opinion. And I'm not the medical person, but, you know, so that's my opinion. Now, what I've done, however, just recently, some folks I know have had this for the last year. But what I've done just recently is put together a task force of members. And I focused on having members from the medical field, members from the legal field, and members from public health, so that they can help ensure that we're not missing anything, administrative staff, management, and board, and then also assist us with putting together equitable policies. Because I happen to lean towards, yeah, vaccination is going to be required. But I'm very concerned about what that means to potential inequities of who's allowed in and who's not. So there is more surveying. Obviously, those that have done surveys of their membership, which frankly we have not, we've just been focused on the virtual land, needs to be done as well. But I'm feeling pretty good about putting together this team to do that. I can tell you the basic questions from the grade school survey, which really are not irrelevant to what I think would still be just as relevant to coming to a rehearsal. And that is, a simple question of asking about a list of symptoms if you've experienced them that day. And it doesn't say you can't come if you have, but it says we need further conversation. And so, and it's a pretty, I'm not going to read the list unless you want to know, you don't want to hear it all. I'm looking at it and I'm not saying those words. Okay. And then it's a question, same question about symptoms in the household, not just the student. Anyone in your household experienced these symptoms today? Just so we know. And then, have you been in close contact with someone suspected or confirmed COVID-19 in the past 14 days? The student. And then again, same question for the entire household. So, and again, it's a Google form, so it auto-populates into a spreadsheet. I don't foresee that being a lot of work. I don't foresee it being long. I foresee this task force helping us to narrow it down to exactly what is pertinent at the time, and then going from there.
That's great. Thank you. I see a question about what about using rapid testing? To piggyback off of what I said earlier about our local mandates, one of them that they were proposing said you either need to show proof of vaccination or a test. Now, I'm sure that some of you will have opinions about this, probably especially Linda, but I know that those rapid tests, number one, they're expensive. Number two, they're not super duper reliable. So, and if you took it 3 days ago, what could have happened in the last 3 days?
Yeah, you've summed up my opinion perfectly. Those tests have been shown, those rapid tests have been shown to be most reliable if they're repeated like a couple days in a row. So it's, yeah, but all of the issues that Kathleen raised are exactly how I feel about them.
So let's go to a question that's a little bit more creative, a little bit more artistic. All of us are suddenly logistics and medical researchers, right? So the question is there a way to incorporate the new skills and technologies we've learned over the past year to maximize our singers and audiences' experiences as we transition back to live? The way I'm looking at this creatively is there are some things that certainly we've learned a lot about, and there are some things that I would love to be able to do more of, like how wonderful that we put together a virtual concert and we had people watching from Australia and New York. I'm sure it's going to be a little bit challenging, kind of like when they have blackouts for home football games, so the people in your immediate vicinity, you need to come rather than watch. But I feel like we could expand our reach tremendously by learning about streaming and offering those services more widely. I also, something that I have seen us wrestle with over the last handful of years is going from that hard line of you must come to every single rehearsal. If you miss one or two in the season, you can't perform, to, you know what, we don't really want you here if you're sick. So, stay home. And I can foresee more ensembles either recording their rehearsals or streaming their rehearsals. Maybe if somebody wants to be active, but they have a 3-week vacation, but they can come to that rehearsal virtually rather than showing up and still participate. I obviously have concerns about that. Like, we don't want people taking advantage of that system. Like, oh, I'll just watch the stream of rehearsal later. Because as a director, I'm like, well, I need to hear you. So those are things that come to my mind, especially John and Robert. Do you have any thoughts on technologies we can use going forward?
Well, I would like, I think that most people would like to run streaming from creating another virtual choir video. And if none of us had to do that again, many of us, that would be just the most happy day that we don't have to commit to that ever again. But I think that what we found is that it gives us a way to connect with an audience in a really unique way that gives, we only perform 4 times a year at most. And so finding ways to keep contact with our audience, with potential singers, is really important, and that's a great way to do it. We can call them music videos instead of virtual choir videos, and maybe we'll all feel better about it.
Right, and people can be recorded. You can maybe record your sound live. I think that's great. The other thing I've loved about it is the ability to collaborate with other ensembles, which, especially the ones that are far away, that we would never generally do. I know that locally here, one of our groups experimented with kind of a live hybrid model where some people were there and recording live, and then some people submitted recordings and they put them all together, and that was pretty cool. Anything from you, Robert?
Yeah, I think the thing that I probably learned is that the visual is super important, and that we have capabilities where we perform to add videos while it's going on. So I think I will start doing that. So there would be visual interest other than the chorus. So creatively, I think that could be interesting. Some people may already be doing that.
Right. And even things like bringing MCs, maybe run a video of them. I know that we did that a handful of years ago in one of our concerts, but now it just seems much more normal.
Yeah.
Throw a video on of somebody. All right. Anything else on that? I think we need to get rolling pretty quick. We'll just zip through these last couple questions here. What do we know about the efficacy of various vaccines and their effectiveness with the new COVID variants, Linda?
Okay, so it's back to the slides again. Let me find it and move forward. This is my last slide. So this is a busy slide, and I apologize, but there was a lot of information that I wanted to convey in a relatively short space of time. Currently, there are 89 vaccines in clinical trials around the globe. 5 are in early or limited use. 8 have full approval, but none in the US actually has full vaccine approval. And that's one of the complaints that you see circulating in various social medias. We are operating under emergency use authorization for the 3 vaccines that are currently in the US. The efficacy of those 3 vaccines in clinical trials has been quite high, with both Moderna and Pfizer coming in at, certainly above 90% for overall efficacy. There's some quibbling around how folks were actually tracked in terms of identifying asymptomatic infection, but regardless, they really appear to be quite effective at preventing significant symptomatic disease. J&J was not quite as effective overall, but they were 100% effective against hospitalization and death in their clinical trial. And honestly, that's really what we want to prevent. What do we know about real world efficacy? There have been 4 studies in vaccinated healthcare workers. These were just reported in the New England Journal last month. There was a study of UCLA and UCSD that showed out of the 28,000 folks that they had fully vaccinated. They had 37 cases occurring after their second dose. And there was a similar study done at UT Southwestern, and they had 4 cases out of 8,000 folks who were fully vaccinated. So these numbers are quite low. Just hot off the presses today is CDC data showing that out of the 66 million fully vaccinated Americans, there have been about 5,800 cases of COVID that they know about, which is a 0.008%, so highly effective across the population. There have been 74 deaths, so this is just a reminder that we are not, fully out of the woods by being vaccinated, but really the protection's quite good. There's question about the efficacy against the circulating variants. There are at least 5 that are in circulation. 3 of these you've probably been hearing about in the news. There's the one that is in the UK, one out of South Africa, and one that's causing all of the ruckus in Brazil. These appear to be perhaps more transmissible and perhaps have a higher risk of death, although I've seen some varying data just in the last day or so on that. There does appear to be efficacy of the current vaccines against the variants, ranging from 22 to 57%. But again, these numbers are changing all the time. So I'm just trying to give you a high and broad overview. There are ongoing trials right now. They're developing new vaccines directed against the variants. They're looking at either producing brand new vaccine, as we do for the flu shot. We create a new vaccine every year, versus combining a vaccine together with the current vaccine, or even administering a third booster shot that's specifically directed against the variant. So just stay tuned. This is all very active research that's going on. It is very clear, though, that reducing the reservoir of virus in the global population is really critical to reducing the emergence of new strains, and that relates to inequity of vaccine distribution around the world. And this is, there's some countries that they're talking about not being able to be vaccinated until 2023. So this needs to be a concern for all of us, and we're not out of the woods yet. The good news is that recent data looking at antibody activity following vaccinations shows that it does remain quite high up to 6 months following vaccination. Again, these are relatively new data, ongoing trials to continue to follow this, but that's sort of the current state of knowledge. Big caveats around all of this, because this stuff is really changing very, very quickly. And so when we get back to rehearsing in September, if we're able to, we may be looking at this differently, but so far pretty good efficacy with regard to duration of activity and efficacy against the strains.
Great, thank you so much. When you have a second, I messaged you a question. You can let me know about that. So speaking of changing an unlevel playing field, what happens if we see a resurgence of the pandemic in the fall? And I know that all of us are just, but what I think all of us need to remember is that this is most likely not going to be a light switch where we're off and then on and everything's fine. We can learn quite a bit by looking at those places that have been able to open. So my colleagues in Australia, for example, when they were cleared to return to rehearsals, they started meeting and they were masked and distanced, and they did that for a while, and then you saw them get closer together, and then you saw them remove masks, and things seemed to be going well and progressing in that direction. And then all of a sudden there was a bit of a surge and everything was pulled back and shut down again. So I think that we need to just ride that wave. Fortunately, we have some good coping techniques. I think the hardest parts are going to be things like negotiating our contracts, and if we have performances set up already. But that's what happened last year, right? we all had contracts and performances, and then we had to change everything. So anyone want to add that before we go on? John or Robert? Okay, great. So finally, for our section, how long should courses continue social distancing and mask mandates? And I'm just going to say that we don't know, but John is going to tell you a little bit about masks. that you
Um,
might like to use?
Yeah, the resonance mask, if you have attended any of Course America's events over the last year, they've been talking about those. They actually do work really, really well. They seal all the way back to your ears. They stand very proud of your face. So while you look like a duck, you don't sound like a duck. It's way, you can open up for good vowels without the mask slipping down on your nose. It doesn't cause the fogging on your glasses, that kind of thing. And it doesn't interfere with the sound like the one that's right up against your mouth. They really are, they're great. Now, I've heard about the Broadway Cares one that's sort of the same, but it has apparently a piece of metal or something in the nose that people are reporting to me that they don't like it as well. It's not as comfortable. But I have not tried that one myself. But the resonance, it's really good.
Is that the image that you sent me the other day, Linda? Or is that something else?
Yeah,
Yeah.
no, that was
I was worried because I'm like, I've got the world's smallest head and a tiny face. And one thing that we liked about those is that they have all of the measurements, and it's like, here's the child size, here's, fits most people of this age, fits most people of this size. Resonance mask, is that the name of the one you were talking about first? Resonance
Yes,
mask
resonance.
typed up there. And then does anybody know what the Broadway masks are called?
No.
I
It's
think
like
it was
Broadway
that.
pageant?
It's like Broadway. It's like Broadway singers masks or something. But you can easily search it. Yeah.
We'll search it when we go to the next. So that wraps up our section about preparing for live season and in-person rehearsals. So back to you, Robin.
Great. Thank you so much, all of our panelists from that section. We really appreciate it. Jane, we're going to take the opportunity to run a quick promo here, and then we'll move on to the next section.
You are all invited back to Zoom a week from tonight, and a really incredible interview that I did with Eugene Rogers and Tesfa Wandamagmu and Alyssa Lee, exploring the 7 last words of the unarmed, an original work by Alyssa Lee and a work that Tesfa conducted. So here's a little preview to get you all interested.
There's always been rooted in culture, community, and expression.
But if we're only going to do it as a gesture and it's not addressing structure, we are failing.
Our country is in a different place. They are ready to have even deeper conversations, more direct conversations.
See you next week.
Thank you. Our next section deals with legal and liability issues. Our presenters are Doug Althauser, an attorney from the Columbus Gay Men's Chorus, and Tim Blanchard Modisette, an attorney from both the Gala Board and the New York City Gay Men's Chorus. So Doug and Tim, take it away.
Thank you, and hello, everybody. As Robin said, I'm the immediate past president of the Columbus Gay Men's Chorus. I'm also an attorney and an addictions counselor on top of that as well. Tim and I would like you to know as we get started, everything about COVID and the law is new. There aren't that many legal cases and frankly, no legislation that concerns COVID or vaccinations. So there's a lot of extrapolation from other laws and other situations that attorneys have to presume with and make, frankly, educated guesses and recommendations. So with that in mind, the first question we're going to work with are, what are the legalities of requiring COVID vaccination documentation for rehearsals and performances once we get past the CDC emergency use designation? I will start with that question, start by answering that question and say, as a lawyer, my recommendation is that you not make a requirement of vaccinations for your choruses. That might be a little breathtaking for some people. Let me explain. There's an argument going on in the legal field right now. As I think Linda pointed out, the vaccinations have been authorized through an emergency use authorization by the Food and Drug Administration. With that EUA, the emergency use authorization, there are some restrictions excuse me, against employers requiring employees to be vaccinated. However, other attorneys have pointed out those requirements only apply to federal employees, like employees of the Health and Human Services Administration or the White House. So private employers such as universities, schools, hospitals, and 501c3s technically would be allowed to require vaccinations. Now, that having been said, an employer is also required to make sure that there are exceptions written into any kind of a policy that would apply to people who don't want to become vaccinated due to religious or disability issues or strong personal preferences. Now, surprisingly also, laws that apply to employees generally don't apply to volunteers. However, if a volunteer wants to bring some kind of an action, they're going to rely upon employment law to give them credibility for a lawsuit that they're going to bring up there. So with all of that, I'll say you can require your choruses to have vaccinations, but you really need to have a plan B in the event that vaccinations just aren't available, or in the event that somebody truly cannot get vaccinated. And for that reason, I would encourage you to still focus a lot more on prevention efforts rather than relying on a vaccine. Having people socially distanced, having people masked, even if you get 98% of your chorus vaccinated, you still are going to have some responsibility to that other 2% if you have made it a requirement that people get vaccinated, because you're going to have that exception to the rule. Tim, is there anything you'd want to add on to that before I go on to the next question?
Sure. So, I mean, I would just say, we start off by saying in this section that there's no case law that really covers any of these issues. And there are no federal rules or requirements that will cover states or local governments or organizations like ours. So there are CDC recommendations that you should definitely look to in making decisions. But I would suggest making sure that you look to your local and state rules, because those are the ones that are likely going to really apply in these given cases. There are some states like New York that are requiring for people to go into performance venues, requiring that they show proof of vaccination or proof of a negative test within so many days. There are other states that I believe, like Texas, that have denied people the right to ask for vaccinations, proof of vaccination. So, just depending on where you live could make a huge difference. So make sure that you know what your local rules or your state rules are, and keep abreast of the CDC recommendations.
I will add also, Karen had talked about providing a list of symptoms to the members before rehearsals and ask them to review that and not come in if they show those any of those symptoms. That's a great idea. And again, that still puts the responsibility on the members and not on the chorus to make sure that people are going to abide by rules. I will say also, with some of the comments that were made earlier, the more that a chorus gives itself permission to obtain medical information or make some kind of medical decision, such as offering rapid testing or something like that at a rehearsal, the more liability the chorus is putting on themselves for that. A chorus is not going to be covered under HIPAA requirements because a chorus isn't going to be a health agency or a contractor with a health agency. But still, the U.S. Privacy Act of 1974 and the Americans with Disabilities Act will require the chorus to maintain strict confidentiality of the records that people are turning over to the chorus. You've got to be very careful about that. Make sure that as few people as possible see those records, and then those records are protected so that nobody can get easy access to them. One more reason why, I'll say again, echoing what Tim said, looking at local requirements and focusing more on prevention efforts rather than vaccination efforts will probably be a wiser way for your course to go. I know there are questions popping up, so I will take a look at them while I'm going to ask Tim to start off with this next question. What liability does the board assume by having the course return to live activities? Is there any impact on general liability insurance coverage?
So we would suggest that you contact your insurance provider to determine if you would be covered in the event someone would contract COVID, get sick, and want to sue you for that. The thing that we would probably recommend the most, though, in this instance, would be to be sure that you make rehearsing voluntary. You make people coming to in-person rehearsal voluntary. Have an alternative method for people to participate in rehearsals virtually if they do not want to come in person. And to also maybe request a waiver from them, which is something we'll talk about in a later question. And those two things can help minimize your liability, but you should definitely contact your insurance provider to see what it is that they would ask for you to require of your members returning, which may include getting a waiver from them. Anything else, Doug?
Not for me. Thank you. Nice answer. Do local regulations or federal guidelines have precedence? How do you find the local regulations? Again, there really aren't any federal guidelines. There aren't that many federal guidelines relevant to COVID, and there are none about performance spaces. How do you find the local regulations? Start with the website of your local health department. Every state's governor probably has some kind of COVID task force that they're working with. Look to state and local regulations. Tim, do you want to add anything to that?
No, I was trying to read through the questions real quick and see if there was something else there.
I'm sorry, did I startle you with that?
No, I'm sorry. I was just reading through the questions too, just to see if there was something from the previous question that needed to be answered, but I'm good.
I was going
Okay.
to come back to those.
Yeah, no, nothing else to add to that one.
Okay. Tim, what kind of waivers do we need from our audience and membership? I'll let you start with that one.
Okay, so first of all, you can ask your members to sign a waiver. You certainly can do that. Doug has actually one that he suggested. This is a very good one. I understand that others have gotten waivers from ACDA that ACDA has used. So you can definitely ask your members to sign a waiver, and you probably should ask them to sign a waiver just to reduce your, minimize your level of liability. But just know this, that whether someone signs a waiver or not, they can always sue you, and waivers don't always hold up in court, even if you get them. So, you just have to understand that and be knowledgeable about that fact. But it definitely doesn't hurt to get a waiver, and it can definitely help minimize your risk, liability risk. For audiences, I would suggest looking to the venue to see what the venue is requiring. You can also add a general waiver to your ticket purchase, whatever ticket site you use for ticket purchases. Add a waiver there that they must check that they have read this and understand this and will agree to this when they purchase their ticket to come to your concert. So you can definitely get waivers in both instances, and it will help to reduce or minimize your liability risk, but you'll never be reduced 100%.
Right. I'm going to, it turns out that I can share my screen, and through the wonder of, I'm not sure why this isn't working out. There we go. Robin, I would be happy to make this available to you for distribution to Gayla if you want as a template. This is what Columbus came up with as our waiver. You see down there, we have the membership sign this. They only need to sign it once per rehearsal cycle, and it's good until the performance at least. It also doesn't cover just rehearsals. It covers any chorus activity that would be involved during that time. A waiver should include at least 3 elements. One should be an acknowledgement that the chorus is not a health authority and cannot make guarantees that anybody who participates will not get the virus. The second thing is that my recommendation is that rehearsals should be not a requirement, but an opportunity that willing members should be able to attend while coronavirus is still a concern. Nobody should get extra points for participating, and nobody should be docked if they don't want to participate during the coronavirus concern. And the third would be an acknowledgement back to the member that they are participating fully as a volunteer. and not through any requirement of the chorus. As an attorney, what I'd want you to do is to prepare as much as possible to defend yourself in the event that some legal action was brought against the chorus. And one of the things that a waiver will do, as Tim said, a waiver doesn't guarantee you won't get sued, and a waiver doesn't guarantee that you will win a suit. What a waiver will do is help you defend yourself, and the stronger you can write to that waiver, the stronger your argument will be that the member understood all of the risk that they were taking by choosing to come and rehearse during that time. I mean, the next question we were asked to comment on, is it legal to require singers who have not been vaccinated to sign liability waivers in order to participate in chorus activities, and the same for chorus staff? And this, we're just going to echo again what Tim had said. Signing a waiver shouldn't be a function just for people who haven't been vaccinated. Signing a waiver should be there for anybody who's going to participate in a chorus activity during a health crisis like a pandemic. It should be something that that you would do at any time. So, okay, I'm getting, Robin, I don't, apparently I may have just shown my notes and not the form. I will see what I can do about that, but I will get you the form as well. Tim, do you want to add anything before we start going into the chat questions?
I would just say be careful too. That, I mean, waivers definitely you can ask for people to sign it. It should be everybody. It shouldn't just be those who haven't been vaccinated. But also be sure that you're not inquiring about other medical issues that might prevent someone from getting vaccinated if they haven't been vaccinated. That would be going into that territory.
Some of the questions that have come up: do legal requirements apply only to employers or employees, or to nonprofits? And nonprofits usually are employers, so they would apply to them as well. Would reasonable accommodation apply to members who aren't able to be vaccinated? Yes, they would. And I would argue that a reasonable accommodation under the ADA would be that if for some reason there would be the belief that there was just unavoidable risk to anybody who came in to rehearse, then anybody who had a disability probably shouldn't be participating at all. It would be a costly accommodation to somehow create, well, if you absolutely can't reduce the risk, then people who are at high risk shouldn't be participating. Yeah, we've got, would it be prudent to hire a lawyer for this, or does GALA provide the forms? As far as I know, GALA doesn't provide these kinds of forms. Like I said, I can make Columbus's form available as a template, but you shouldn't just copy Columbus's form and use it yourself. You should have an attorney who's associated with your course take a look at them. Does a self-certification of vaccine status constitute a health record? If someone is giving you a piece of their medical information, it may not be considered a health record, but it's still something your course should consider to be confidential. Tim, is there anything more that you can say about everything that I'm talking about?
I see some people talking about release of a liability forms. That's the same thing as we were talking about with regard to the waiver, just a different kind of a name for that. But
okay, and does it help to get a waiver notarized? No, that wouldn't necessarily help. It's the no, it wouldn't help to get that done.
In addition to Doug's waiver too, like I said, I think I've heard that other people have gotten some waivers from ACDA, so you may be able to find one on their website.
Okay. Are there other questions that we might entertain, or Robin, that you can think of that we might have missed?
No, I think we're set. We will, for any of the questions that we aren't able to get answered tonight, we'll get those back out to you, and we'll get responses to the individuals posting the question.
Okay, and we'll still be here in case anybody has a question in the next few minutes.
Great. If you see something in the chat, feel free to answer it in the chat, and we'll, for the sake of the timing this evening, we'll keep moving.
All right. Good night.
Thank you very much, Doug and Tim. All right. The next section this evening has to do with more on the administrative side of preparing for live performances. And our panelists for this section are Jeff Heine, Justin Fiala, Executive Director with San Diego Gay Men's Chorus, Justin Fiala, Executive Director, Gay Men's Chorus, Washington, Steve Smith, Executive Director, Berkshire Choral International, and Craig Coogan, Executive Director of the Boston Gay Men's Chorus. So Steve and company, take it away.
Hello. Remember when singing used to be fun? We're not going to help. This is the Preparing for Live Performance section, and we've pared this down to 4 sort of big questions, and each of us will take a whack at it. Just so you know what's coming up, we're going to talk about if our venues have limitations in terms of capacity, how do we calculate the economics of giving concerts, and how do we balance the money versus the mission? We'll talk about what some front of house best practices are. We'll talk about communicating with audiences and where you can find more information. So, and we're going to do it like the wind. So Craig, take it away.
Good evening, everybody. I'm going to talk about the first question, and it's an answer that we've already heard a couple times tonight. Each chorus and organization must evaluate for themselves the balance between what they need to do to fulfill their missions and the financial realities of reduced ticket revenue. In our case, in Boston Gay Men's Chorus case, the decision is also informed by venue availability. Our home concert hall announced a couple months ago, they're close to the public for all of next season and will not consider reopening until September of 22. So there's a dozen arts organizations in Boston hunting for new space. So the whole supply and demand and the effect on the cost of that space is a dramatic issue. There's also a wide range of options for choruses and how they come back from an audience perspective. And again, that's largely determined on where you're located. In Texas, I believe that today you can be at 100% capacity, fill the hall. While today in Massachusetts, we have a capacity limit that is 25 to 50%, depending on your venue type. Then each venue has to go and have a COVID plan and have their city approve it. In addition to that, here in Massachusetts, the state precludes singing inside, except if you're a soloist in a house of worship that's like 14 feet away, or if you teach kids 18 and under, you get like 30 minutes with masks. The point is that the rules are very different across the country. So we all need to be guided by the rules in our communities and be sensitive to them. We also need to recognize when our audiences are going to be comfortable coming back. So if there are audience limitations by your local councils, then I also think that by that similar theory, that gathering limitation affects our choruses and our chorus distancing requirements. So if it's not safe for an audience to sit together, then it's really not going to be safe for the chorus to stand together in close proximity. I know that there's not complete agreement on it. That is just my perspective on it. In addition, in our case, we are a larger organization and we've got to put 225 people together in close proximity in order to produce the sound that we and our audiences are used to presenting. My final point is that we as a sector, as an arts and culture sector, undermine the value of our product enough as it is. I think it's not a great idea to further disrupt the economic viability of our organizations by deliberately producing at a loss when we're coming out of a sustained hiatus. We're demonstrating to ourselves, to our singers, to our audience, the power and the impact of live performance, of what a shared experience is. It's extraordinary. And I think demonstrating that value actually means we should be charging more, not less.
Can we say that again? Charging more, not less. Music to some people's ears. It's a big issue, and Craig is being just a little bit provocative, but I agree with him. So let me move on to some front of house considerations. And I've just put this in writing because there's just so much here. And I'll share this with Gail, so don't feel like you need to do anything. First, with venues, who's going to be responsible for front of house for the audience experience? If you rent from a venue that has professional management and its own front of house staff, you're not really going to have to come up with the rules, but you are going to be stuck with what they do. And keep in mind that if I run a venue, I'm going to run things to protect my liability, not your convenience or the way you want to do things. So in venues that you may have had a way of working before, that's probably going to be quite different. And you're going to need to think about how to change your procedures to fit new guidelines that the venue imposes on you. For those of us that perform in venues that don't have professional management, these would be churches and school auditoriums, et cetera, you're really going to need to create your own front of house audience rule book. And all I can say is steal from professionals, talk to someone at the local symphony hall or a theater, see if you can talk to their front of house manager and steal good ideas from them. You don't want to do this from scratch. And keep in mind that if you are running front of house yourself as your own chorus staff and volunteers, you're going to need to spend much more time than you're used to training them how to do that. And don't forget that depending on where we are in the pandemic, you may need to think about providing protective equipment, for, masks or worse, let's hope not worse anymore, for your people. So first issue is that even where you're going to sing, there'll be different people will be making the decisions on what the audience can do. Next, I want you to think about requirements versus perceptions. As Craig and many others have said, our states and our cities are going to have requirements. There might be hall guidelines. You can have 20% in the house or 50%, or everybody can come in. There are also cities and states where you have to seat people with distance. So you can only sell every second or third row. Obviously, these will vary, and you just need to be aware of that. That's what's required. But the audience's perception of what is safe, may make no sense whatsoever, but perception never does. So you will want to think about what can you do to enhance people's sense of safety. If you are in a hall that has better ventilation and air filtering, by all means, you will want to advertise that. That will be a great selling point. If they don't, you're not going to talk about it. Other thing, and I'm not recommending these, but things like clear signage, having masks and sanitizers in front of house, restroom cleanliness, I think will be one of the most frightening features for audiences coming back. And we won't get into it today, but hall, there may be vaccine passports or entry credentials. If you look at the travel industry, they're going to have them, and some larger venues, rock venues, that kind of thing, are already implementing them. So lots of stuff to think about there. Emerging best practices, minimizing contact between people at both the box office and with ushers. So either no or limited door sales and will call, sell everything you possibly can in advance electronically. If you're in a hall that has electronic readers, you should be doing that. If you don't, can you devise some sort of big print ticket so the usher doesn't have to lean in towards you and see in 4-point type where you're sitting? Can you do it in 24-point type? Minimizing lobby crowding. Many halls are going to open their houses early for seating so that there's not a rush of people waiting in the lobby and then you open the doors. This will probably affect, many of us have choruses warming up on stage until the last possible minute. That's probably a thing of the past. You may need to be thinking about eliminating food and beverage service. And I'm seeing some places talking about seating audiences in a staggered method. So if you sort of think airplane boarding and how miserable that is, that may be ours as well. I think audience flow is a big thing. One-way flow is what I'm hearing about. So clearly marked entrances and exits, as opposed to the old model where, you have the doors of the auditorium and people coming in and going out the same doors. What I think you will be seeing is sort of an arc where everyone enters through one side and then exits, let's say, through a side entrance of the hall, so that you don't have people going back and forth. Think of what we've seen in supermarkets, both in terms of floor signage or stanchions or ropes to sort of guide people. You'll be seeing that. I think a big thing to think about is producing concerts without an intermission. Intermission is terrible for two reasons. One, crowding in the lobby. Did I say one or A? One, crowding in the lobby. Two, bathrooms. Everyone is panicked about bathrooms and sanitation. And lastly, I would say we need to think about limiting socializing, which is terrible for our choruses. But pre and post concert events should be outdoors when you can. And I would say a strict rule that singers should not be allowed front of house, period, end of story, because that just becomes, well, you know what that becomes, I don't have to tell you. Big picture, 4 points. How we handle the audience's early experience back will either improve or wreck our reputations as caring and responsible organizations. I don't care how well you sing, if the audience has a fearful or stressful experience, you're dead. As social justice advocates, we need to be role models for the highest standards of safety protocols. We should be doing better than average. And I would say that there may be an opportunity for you to partner with local healthcare institutions, particularly if there's an LGBTQ healthcare provider in your city, perhaps to be on site to just be a visible sense of medical advice. And I think you could also be a partner in being sure that vaccinations are getting to every corner of our community. And lastly, acting with transparency means building trust. So that is it for front of house, and we'll move on, I think, to Jeff.
Yeah, I'm going to be talking about adding on to Steve's comment about trust, about how do you maintain trust with your audience in terms of how you communicate with them, especially during these quote unquote uncertain times. How I'd like to start with this would be perhaps to think back to those original communications you sent out to your audiences well over a year ago, in March of 2020. I mean, speaking from my own experience here in San Diego, I remember in March on a Tuesday, we had sent out an email to our audiences saying that everything's a go. We're still planning for our shows in late April. 2 days later, we sent out an email saying we were canceling said shows. And the following week, the state of California went into lockdown. So if you remember back then, we were just, things were changing on a daily basis, and we had to adjust to that. So look, if you haven't communicated with your audiences in a while, I would recommend, first of all, just review past communications like that you may have sent out when the lockdown first began, just to review the tone and the tenor and the verbiage that you were using at that time and how you were communicating to your audiences. And as we communicate now, don't be afraid to backpedal, because you could come out with something based on the latest guideline, and a week later, things have completely changed. And I would argue not to worry too much about that creating a lack of trust with your audiences, because we're not the only organizations in town that are dealing with the exact same thing. Other organizations, as they start to reopen, will be communicating to their audiences as well. And just like we were all closing up piecemeal a year ago, as we go through the reopening phase, don't worry so much if you have to backpedal because the news changes. So with that, it is very important, as you've been hearing tonight, to stay on top of the current guidelines, not only CDC guidelines, World Health Organization guidelines, but even more importantly, the guidelines in your own county, your own state, your own city. You need to just be aware of what's going on there and crafting messaging accordingly. For an example, here in California, it was announced a couple of weeks ago that if all things continue to progress as they seem to be, on June 15th, our tiering system will go away, effectively allowing organizations, businesses, whatever, to reopen far more easily than they would on a tiered phase-in basis. When that announcement came out, we sent a message to our internal audience, our chorus members, just basically saying, all right, June, what does this announcement mean to us? Just because we can open on June 15th doesn't mean we will open on June 15th. And what we said was everything is status quo, as we've already announced. We are doing 2 more virtual concerts, one for the spring, one for the summer. That will continue as is. What we haven't done yet is the follow-up communication to our audiences and our donors with this information, what it means to us. And we've just been waiting on that as well. Essentially, we're waiting for the next communication that goes out that talks about our 2 shows, and then also our response to the governor's announcement. So with that messaging, we're focusing on what we can do versus what we can't. What we can do is that we're presenting a couple of shows. What we can't do yet are, A, B, C, and D, and so forth. And you're knowing that things can change. It doesn't hurt in your communications and on your website whenever you're announcing something. Don't hesitate to rely on that good old footnote, subject to change, because things are always subject to change. And, so keep that in mind as well. So Steve, that's what I've got for tonight.
Great, thank you, Jeff. And we'll go on to Justin. Where can we learn more about these fascinating topics?
Thanks, Steve. Thanks, everybody, for joining tonight. It's so good to see you all. So I will keep this as short as possible. I was tasked with two of our group's questions. The first is, where can we find additional information on audience attitudes? And then the second was, how do we go about surveying, and what are the pros and cons of surveying our audiences? So the first one, where can we find some more information about audience attitudes and what people are thinking and when they're going to be ready to come back and whatnot. So I'm going to share with you three resources that I've been following closely, and I'll put some links in the chat as well as some documents as I go through these. The very first one is the Audience Outlook Monitor. Some of you have probably heard about this. This is a great national effort to kind of reach out to many different arts organizations, venues, presenting organizations, those types of things, in order to kind of call as much data as they possibly can. And they're basically relying on, going out to each one of these organizations, then those organizations send out the message to their patrons and audience members. And what's really cool about this is if you're part of the AOM, you can see your data and use that to the best of your ability. Then you can also compare it with regional and then national data as well for each one of the standardized questions. I'll point you to the website that I just put in the chat box. There was just another report that came out in March. They come out every couple of months or so, but then they also put together really great videos that kind of do either a kind of upper level dive into the information that they're finding in the report, or some of them go into a really deep dive into the information. But there's some really cool information there about when audiences are going to be back, how they're feeling about the vaccine. And what I found very interesting is to see how those attitudes have really changed over time. So take a look at that, really, really great. And we're actually, JMCW is going to be part of this initiative, and we're really excited about that. We want to be able to not only use our own survey data and know what's going on in our realm of the world, but also be able to compare that to the larger scope of things. And I think that that's a really positive thing for this. The second one is Colleen Schneider, and she does really fabulous video overviews. She has really interesting subjects in article format. So I'm going to pop that link in the chat as well. Just go to her website. Then there's a tab at the top that says COVID-19 updates. Really fabulous and interesting, well-written articles there. So I encourage you to go to that one as well. And then the third one is La Placa Cohen, or you probably know it better as Culture Track. And this is, really great overall research in general on the cultural sector. But right now they're doing a special Culture plus Community in a Time of Transformation that just came out not too long ago. And it's a national research and strategy initiative to support the cultural sector and help strengthen our community during these trying times. And if you have, so those are three resources that I've been following, that others on this call I'm sure have been following quite closely. If you have other resources that you found helpful, I encourage you to put those in the chat so that we can, kind of get a knowledge base going there. So the second question that I'll go into is, what are the pros and cons of surveying your audiences? So some of the pros are that when you ask somebody for their opinion, when you ask somebody for information, you're making them feel like they're part of your community. And that's a really important thing, especially right now when we're so isolated and all feeling so disconnected and all of that. Surveying can be a really great way to be in touch and to make those people who are so important to your community feel loved and supported and like you value their opinion. It's an opportunity to also let them know what you've been up to. So when you send out the survey, you can also give some updates on where you're at and you're thinking about when you're coming back, what's next for your organization, things like that. Surveying is relatively easy to do and is relatively inexpensive. In some cases, it's free if you go to the Google route, which is a great survey tool, in my opinion. But you do have to ask the right questions, and that's the tough part. That comes at the very beginning. You have to find out, what do you want to know? How are you going to use this information? And what questions are going to get you to that point? Some cons to surveying. Number one, if you ask, they will tell you. So don't ask things that you aren't going to change or aren't going to make any movement on. You want to ask things that are really going to help you in your decision making. And then another con is that sometimes when we survey our kind of group of the world, it's really hard to put that into context, right? So I would encourage you to, when you're doing the survey, take a look at your results and what's happening in your bubble or so, but then also compare that to some of the resources that I shared earlier to see how your region, locality really kind of matches up with what's going on nationally, globally, etc. Just a couple quick tips. So we touched on this a little bit earlier, but when we're talking about doing a survey about COVID or anything that's really private or sensitive information, you have to make sure that it's going to be anonymous, or you have to communicate really clearly about who's going to see those results of that survey and how the information is going to be used. That is absolutely crucial. If you do not communicate that and you have a data breach or something bad happens, those people are going to be really, really upset with you. Like I said, take the time to develop questions, but also take the time to develop answer options that are really easy to understand and, again, are going to be helpful to you in the decisions that you need to make going forward. Keep it short. That'll help your response rate. 10 minutes is a long survey, so keep it as short as possible. And I'll always like to offer a prize or get entered to win a $25 Amazon gift card. You've all seen that. Or the first 100 respondents get a special CD or a piece of merchandise or something. That's also going to bump up your response rate. Prime your audience. Let them know that this is coming. Let them know that you would very much appreciate their response. Not just saying we need information, but we need you to tell us what you're thinking and what you need from us at this point. Also, know your audience. Are you talking to your singers? Are you talking to your audience? Are you talking to your donors? Who are you talking to, and what are they going to be able to answer for you? And what data are you going to be able to pull out of them? That's really important in the question development section of the project as well. And then keep track of people who have responded. I hate getting an email that I've already responded to. I've already filled out this survey. Why am I getting this reminder? Filter out those people so that you're not filling up their inboxes. That can really lead to some irate patrons. I won't go there right now. And then, absolutely crucial, don't just let it hanging. Once you have that data, tell them what you're going to do because of how they responded. Tell them what changes you're going to make or what changes you're not going to make, whatever it is. And always, always, always make sure that you thank them for filling it out, for taking that 10 minutes of their life for you to have better data so that you can make better decisions. So that's all I got.
Great. Thank you to our team. We're your dream girls. We're out of here.
Thank you very much to that group. And our last section this evening, my apologies, we're running a little behind, but you know, that's life. The last section this evening is about connecting with our singers as we try to get back up and running again. And the presenters for this group are Melissa Arasi, the Artistic Director of the Atlanta Women's Chorus, Kristen Stennett, the Artistic Director of Common Woman Chorus, and Miriam Davidson, Artistic Director of Anna Cruz's Feminist Chorus.
Hi, everyone. So our section really is about the comfort and care of our singers. And quite frankly, the three of us think that's pretty darn important. All of this legal and technical stuff is crucial, but if you don't have the people that you love and care about with you, I'm not sure it'll matter. So the first question was about, do we anticipate any difficulties of all of our members coming back? And the answer is, yeah. I mean, just like with any survey that we've talked about, the singers are pretty much all over the board. They somewhat to be back right now. Some are going to be concerned. And we've thought about some things that possibly could help bring them back, but also just comfort some of them in this process. Miriam, will you share a little of the things you're doing and going to do?
Yeah, sure. Our membership committee has been working, I guess, for the past month or so to reach out to every member of the choir who's currently active, everybody who took a temporary leave when we started being on Zoom, everybody who's been on leave for a year. And they're keeping track of everything they find out from these people about if they're going to come back, if not, why, what they would feel comfortable about seeing in their return. And more than anything, it lets them know that we value them and we value their opinion and we value their presence.
Yeah, and kind of like Justin was just talking about, not a lot of questions, but getting that connection, personal connection. I think, Kristen, you talked some about a personal note.
Yeah, well, I spent some time over the holidays and sent out holiday cards to everybody on my roster. And it felt like a nice way to connect personally. Everybody likes to get some snail mail every once in a while. And there's someone else in our chorus who's actually been sending out birthday cards on a regular basis. And so just any kind of way you can try to stay connected, especially since we have a lot of singers who aren't participating right now. And so being able to reach out to folks who haven't been able to show up for various reasons and just let them know that you're still thinking about them.
Yeah. So I think we're definitely thinking there will be some hesitancy with some members to come back. But I think as long as you have a plan for trying to get them, that's probably the most important thing. Another one of our questions was, how are we culturally and perhaps even socially reuniting the organizations? Miriam, you want to speak to that? These are kind of connected because, again, it's all about the feeling of the chorus members.
Yeah, people have a vested interest in the things that bind us together, you know, our social justice missions, our inclusion, talking about inclusion and belonging in our organizations. And one of the first things that we did once we started not meeting in person was to really take a deep dive into both of those things. And frankly, they've been the most successful working committees we've ever had. I mean, they meet once a week, they're there on time, they come back and report to the choir, we've got things to do, and it's really been remarkable. But it has the thing that has kept people coming back every Monday night for a year and some.
Yeah, we've done that as well. We've been working with the New Harmony workbook. And I think it's provided an extra opportunity, you know, because we always want to do these things and spend more time. And there's just only so much time your volunteer singers are going to give to you. And it's been a perfect time to do that. Now we just can't lose it. So that's definitely building on that. Kristen, what did you want to share about that?
I actually think Miriam covered that really well. I mean, I think our chorus is doing a lot of the same things, and it's keeping us connected on a different level, knowing that, you know, singing into a computer where you can't hear everybody doesn't feel the same, but being able to connect through all these other channels has been really positive.
One thing that popped up while we were discussing these questions was and we've talked about it a little bit tonight, is that how are we going to manage the normal restrictions, the protocols that we normally had in choir, of expectations of being there and those types of situations, knowing that we're not going back to normal. It's going to be different, but how to balance those things. Any thoughts about that, Kristen or Miriam, either one?
I've just been thinking about how it's been lovely to have a flexible format for our chorus. There's something different going on each week. We don't sing every week. Sometimes there's socials, and sometimes we're doing racial equity work or whatnot. And so people get to pick and choose, or if we're working on a song, they might work on this song, but maybe skip out on the next one if something else is going on. So they have a lot of flexibility right now, and at some point in time, whenever normal gets to happen again, we're used to having attendance expectations, and we have a big chunk of music to learn. And so I think we just need to acknowledge that and know that we might not be able to just hit the ground running like we're used to doing, and take that into consideration. And so maybe we're not learning all this as much music. Maybe some nights we reserve more social time, and just being more flexible in how we're running our Tuesday nights, or what night you rehearse.
Yeah, and in retrospect, I kind of look back on the way things have typically been, and kind of feel like the gerbil on the wheel, got to get all this done, and everybody's got, so you go into rehearsal all revved up, and you go home and you're all revved up and you're exhausted because you've been, trying to keep to this schedule. And it seems to me that maybe we don't need to do that. And that because of the kinds of things we're going to need to be thinking about in terms of accommodations and all the stuff we've been talking about, that maybe our boundaries need to be a little bit different.
Yeah.
Our attendance policies need to be different. What are our start times like? What are our on-leave policies like? And are we going to be streaming our rehearsals for people who aren't going to be there? And frankly, we've been streaming rehearsals for 3 years. And my fear was that people, well, I'm not going to go tonight, and maybe I'll watch that and maybe I won't. But frankly, people did not abuse it at all. We had great attendance, and people wrote me to say that they were going to be watching the live stream, and
that's great.
It worked really well.
Another of our questions was about the singers getting their voices back into shape. And I in my own choir, every rehearsal, remind them that if they're not really singing and really singing often, that it's not going to be the same when we get back. And you can tell that probably from their individual virtual choir recordings that you hear. It's going to take some work. We talked about a lot of opportunities to give resources, and there's lots of things out there. I personally plan on sending out, especially when I start doing auditions, probably in August, assuming things, that I'll start sending out some weekly reminders of vocalises and things to get them really engaged in singing and getting prepared to come back. Kristen, Miriam, what are you planning on doing to get them ready to sing again?
We've been using anything on YouTube that looks fun and is helpful. We've been doing a lot of sight singing and solfege and vocal warm-ups, and putting together a playlist of all these things for the singers, so they don't have to search for everything, and they know that they can go to that one spot and there'll be things for them to do.
Yeah, and so I live down the street from Duke University, and their Duke Voice Care Center is a really wonderful resource. And typically they hold conferences for World Voice Day, but then this past year they've been all virtual, and they've published all their webinars. And so I'm going to add some links to the chat directly to some webinars. There's a two-part webinar plus a Q&A session. And this coming World Voice Day, April 28th, It's a Wednesday night from 7 to 8:30. They have another session about how your voice is essential. And they talk about a lot about vocal health, and they work through some exercises. And it's a great way to learn about your voice. And you're welcome to steal all this. It's on YouTube. And you can register for this workshop on April 28th. It's free. And you can be like you're hanging out in Durham.
Hey, Miriam, they're asking if you have your YouTube playlist.
Yeah, I'm looking for it.
Okay, great.
I'm looking for it. If I can't find it, I'll make sure it gets out.
Awesome, perfect. Our last question was asking about questionnaires that we might be using to gather information from our singers. And I think we've really covered the importance of questionnaires. I've surveyed my singers just to kind of get their pulse. And I think more than anything, we've all agreed that they just really like the opportunity to tell you what they're thinking and being heard. And not everyone responds, but I know that with my singers, just that I've asked them helps a lot, that it's not just some people sitting in a corner making decisions without hearing what they have to say. So anything else y'all want to share about questionnaires?
Not questionnaires exactly, but one of the things that we were talking about yesterday was that I think we need to be thinking about ourselves and the care of feeding of us as directors, and not just as our singers. We're all going to have lots of feelings when we get back together. We will share some of those feelings, and then we're going to have different feelings too. How do we feel about standing in front of our choirs? It doesn't matter how big or small we have. I mean, for one thing, but after a year and a half of being apart, I think we're going to need to give ourselves the grace of some emotional space also. And I think expecting too much of ourselves, of being able to keep it all together and moving forward on our own, might be too much. And we just need to think about that. Self-care is important too.
Bravo. Absolutely. Kristen, any final words?
No, I love what Miriam just said. I'm going to take it to heart.
I know, right?
Me too.
Let's live what Miriam
I'm not good
said.
at it. I'll say right now, I'm not very good at that, but I'll try.
Well, I'll try to live what Miriam said.
Right.
Thanks.
All right, many thanks, heartfelt thanks to all of our presenters this evening for sharing their time and their experience and their thoughts with us. The reality of 99% of what we've talked about tonight is there is no one right answer, but there is wisdom to be shared amongst ourselves. You're not answering these questions alone, so don't hesitate to reach out to each other. You can do it through us. You can do it directly, but don't try to feel like you need to work this all out yourselves. There are lots of people out here willing to share their experiences. So thank you much for joining us this evening. And just another plug for the Rise Up virtual event next Thursday night. It is an incredible discussion of the intersection of choral music and racial justice with some incredibly powerful interviewees and some terrific music. So good night and thank you much. Good to see so many of you. And God help us, we'll all see each other again one day soon.
I'm glad to go. I cannot tell a lie. I flit, I float, I fleetly flee, I fly. The sun has gone to bed, and so must I. So long, farewell, auf Wiedersehen, goodbye, goodbye.
That was awesome. Good night, y'all.
Good night, all.
Night, everybody.
Good night.
Thanks for the music, Jane.
Good night.
Good night. You're
I don't, no, you hang up first. See ya.